Good day, Trinidad and Tobago. You have just tuned into the most accurate and up-to-date source of information on the national COVID-19 response. That is, the Ministry of Health's COVID-19 media conference. Today's panel of presenters are the Honorable Terence Dial Singh, Minister of Health, and Dr. Miriam Abdul Richards, Principal Medical Officer of Health Institutions. I am Odessa Curlane, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator for today. We begin with Dr. Richards, who will present the latest clinical update.
Good morning and thank you very much, Odessa. Good morning to our Honorable Minister of Health, Minister Dial Singh. Good morning to all members of the media. Thank you once again for your continued attendance and participation in the Ministry of Health's press conferences and for providing accurate and up-to-date information to our country. And to all our viewers and listeners, Trinidad and Tobago, regionally and internationally, thank you very much. We really appreciate your attendance at our conferences. Good morning. This morning, my presentation will be in two parts. I will start with the summary of the Trinidad and Tobago COVID-19 dashboard number 1190 and then followed by a summary of the parallel healthcare system and the status of our hospitals. However, before I start, and on the eve of our 60th anniversary of independence, I would like to recognize the efforts of our selfless health team in all our RHAs across the traditional and parallel healthcare system. These doctors, nurses, attendants, cleaners, lab staff, administrative professionals, ambulance drivers, and of course the chief executive officers and lead clinicians across both the parallel and traditional healthcare system have indeed provided selfless national service over the past 2.5 years. And we would not have been where we are had it not been for their continuous support and their resilience. I'd like to now move on to the COVID-19 dashboard number 1190, dated the 23rd of August 2022. There were an additional 295 cases of confirmed COVID-19. This takes the total active positive cases to 6,617 and the 7-day rolling average to 273. Unfortunately, there were 3 additional deaths recorded, and we would like to express our condolences and our sympathies to the families of the deceased. This takes the total number of persons who have passed away from COVID-19 to 4,108. And again, sincere condolences to all friends, loved ones, and relatives of the deceased. Our overall vaccination coverage is 51.2% nationally, and the Honourable Minister will go into more details regarding a breakdown of the vaccination statistics. I'd like to now move to a summary of the parallel healthcare system as of 8 a.m. on the 24th of August 2022. This morning, the overall occupancy of the parallel healthcare system is 43%. There are 237 patients in the hospitals in the parallel healthcare system. And of those, 215 are severely or critically ill, and they are at the hospitals, whereas 22 are recovering in step-down facilities. And the 22 patients are actually at the area hospital, Point Fortin, which was reactivated as part of the Ministry of Health's response to the increasing number of cases noted at the end of July. We also look at what are called precursor indicators, and we discuss and we review the number of patients in the accident and emergency departments, because increased case numbers obviously results in an increased number of persons being hospitalized, and the first point of contact would be in the traditional healthcare system. This morning there are 27 patients across 10 accident and emergencies in the traditional healthcare system. The ambulance usage is at 18%, And the rolling 7-day average in terms of the percentage of ambulances used for COVID-19 transport is 17%, and that's been constant over the last 2 weeks. At our ICUs in the parallel healthcare system, there are 9 critically ill patients. And of course, we pay attention to the ICU numbers because these are the patients who are most critically ill and require the most resources. Ladies and gentlemen, these statistics really underscore and remind all of us that COVID-19 is still here with us. The Ministry of Health continues to closely monitor on a daily basis the clinical nature of the patients who are being present and who are accessing the accident and emergency departments. We monitor the confirmed number of COVID-19 cases, the number of patients at the ward, ICU, and HDU level, the number of recovering patients, as we continue to support and provide a response to the COVID-19 pandemic. However, we continue to see and note that the significant proportion of patients are not fully vaccinated or unvaccinated. Between the 22nd of July 2021, and the 17th of July and the 17th of August 2022, approximately 80% of all patients who have been admitted to hospital because they are severely and critically ill are not fully vaccinated. And this is a reminder to all of us that we should become vaccinated, receive our boosters as required, because vaccination protects against severe disease, hospitalization, and death. Vaccination also reduces the risk of transmitting COVID-19 to our relatives and children who cannot be vaccinated and may be considered vulnerable. As I close this morning, I would like to just, on behalf of the health team, Dr. Parasram, Dr. Trotman, and Dr. Hines, wish each and every one of you a happy and safe Independence Day. Let us continue to practice healthy behaviors. Let us continue to remember that COVID-19 is with us, and let us continue to be vigilant. Be safe, everyone, and thank you very much for your attention.
Thank you, Dr. Richards. We now go to the Honourable Minister.
Thank you very much, Odessa. Good morning to Dr. Richards, ladies and gentlemen of the media, and those members of the public looking and viewing on. I would like to agree with Dr. Richards and to also add my happy Independence Day greetings to Trinidad and Tobago on the occasion of our 60th anniversary next week, Wednesday. And again, just like Dr. Richards, to really send out my heartiest congratulations and thanks to healthcare workers who stood with us, who stood with this country through thick and thin, managing a once-in-a-100-year pandemic. Countries were doing this for the first time, and I think by any objective measure, our healthcare workers across the system, from the ministry to the RHAs, security, cleaners, administrators, HR, lab techs, mortuary attendants, nurses, attendants, doctors, everyone pulled not only their weight, but the weight of their colleagues when persons had to be unavoidably absent from work due to COVID. It was a great team effort, and as Minister of Health responsible for that team, I could only express my deepest gratitude to them as we celebrate our 60 years of independence. The COVID vaccine numbers continue to be very low. Yesterday, we would have administered a total number of 103 doses, which is really, really small. First doses, second doses, boosters. Numbers of persons completing their vaccination program, 716,230, which is just about 51.2%. Number of persons boosted, 168,063, And let me urge people who have not yet been boosted to please go out. It's not too late to get your booster shots. I think the recommended time period is at least about 4 months afterwards. Please go and get your boosters to give you that extra level of immunity. Because what we are seeing in the hospitals still at this stage of the pandemic is that over 80% of persons coming into our A&Es and being hospitalized are unvaccinated. So the evidence is there that the unvaccinated really are the ones at higher risk, and the vaccinated are at a much lower risk. The number of the 5 to 11 children who started their vaccination program is 3,301. I want to give the parents of the 5 to 11 advance warning or advance notice that because these vaccines, which were so kindly donated by the government and people of Spain to Trinidad and Tobago, and we should be eternally grateful to the government and people of Spain, that batch of vaccines will expire on the 31st of October. The gap between first and second doses is a minimum of 4 weeks up to 8 weeks. So we are advising parents that the absolute final day to administer first doses is going to be the 30th of September, which will allow you just the 4 weeks to get the second shot in. But don't wait until then. We are giving you at least a month's notice that if you are desirous of having your children 5 to 11 vaccinated, especially as school is going to reopen sometime in September, take advantage of the offer now. Don't wait until it's too late. We don't know what variant is around the corner. We don't know what is around the corner with COVID. So let's be a little bit proactive. Take your children out to be vaccinated. And the final date is going to be 30th of September. On the monkeypox front, I can report that we have sent 12 samples for testing. To date, all 12 samples are negative. Sample number 13 is being run as we speak. Hopefully that will be negative, but we keep our fingers crossed. On the global scene, there are now 38,888 cases in 93 countries. 38,888 in 93 countries. With Europe constituting 51% of those cases, the Americas, to which we belong, 48%, and 2 deaths reported in the Americas, and 1% in Africa. So that is global distribution by region of monkeypox cases. There, we got some correspondence from PAHO about the procurement of the monkeypox vaccines when last I reported to you. I said that, and Dr. Etienne confirmed this, that PAHO will be dealing with the lone manufacturer for monkeypox vaccines called Bavarian Nordic. Bavarian Nordic will not be negotiating with individual countries. They will be negotiating with PAHO, and individual countries in the Americas will go to PAHO. Trinidad and Tobago was one of the first countries to sign up. So we have now got correspondence from PAHO that we have to do the usual indemnification agreement by the Attorney General. Same process that we had used in the past to procure COVID vaccines. So that's the latest update on the procurement of monkeypox vaccines, in that we now have to go, we got confirmation from PAHO that we need to have the indemnification agreement, and that will be sent to the Attorney General's office before the end of the week for his positive vetting. So that's another step forward in the procurement of our monkeypox vaccines from the lone manufacturer Bavarian Nordic. So that is where we are on the COVID front. That is where we are on the monkeypox front, both internationally and locally. And Odessa, I think we can now go to questions and answers.
Thank you, Honourable Ministers. He stated, next up is the question and answer segment. Members of the media, you're reminded to state your name and the name of the media house that you represent before making no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. We will take 1 question per media house in all subsequent rounds of questions. Today, we begin with questions from Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited here. You all hearing me?
Yes, we are.
Okay, excellent. My first question is to Minister Diyal Singh. Now, Minister, last night the Prime Minister was speaking in a forum, and he did indicate that he is going to instruct the Minister of Finance to give a bonus to healthcare workers. Could you give us any more details on that? Would you have a say in who's getting that bonus? And my second question, I believe Dr. Richards might be the best person to answer this. Dr. Richards, we are seeing hospitalizations going back up now, but I do understand that in the time when hospitalizations were a bit lower, that a number of doctors, their contracts may not have been renewed and that sort of thing, or maybe have been given a shorter term. So what is our staffing like within the parallel healthcare system and even the traditional healthcare system now that hospitalization numbers are going back up? Is there any intention to probably bring back on stream any doctors or anything like that? Thank you.
Thank you, Richard. So I will take both questions. Those are policy decisions. So on the issue of the first question, the Prime Minister announced last night, and I must thank the Prime Minister for recognizing the heroic efforts of our healthcare team. He did indicate, and it's in public domain, that he will advise, or his exact words were to instruct the Minister of Finance to make the necessary appropriation in the 2023 fiscal year in the upcoming budget. I would suggest that we wait until the budget for more details, and I will surely be having some discussions with the Minister of Finance now that the Honourable Prime Minister has given him that instruction. 2, on the issue of staffing. Staffing of the parallel healthcare system is under the remit of the RHAs, not the Ministry of Health, not Dr. Richards. Staffing will always be ramped up to care for the numbers of patients that we have. So, for example, we reactivated the area hospital Point Fortin as a step-down facility, so naturally we will have to have additional staffing there. So staffing arrangements will always be under the remit of the RHAs depending on their needs. Okay? Thank you very much, Rashad.
Thank you for your clarification, Minister. Next up, we have questions from Newsday. Good morning.
Morning, Chantak of Newsday. My questions are dual. I mean, either Dr. Richards or Minister could take the questions. The first off is, seeing that Guyana has recorded its first case of monkeypox, does that imply that we need to be a bit more vigilant in terms of our preparations for maybe a possible first case? And secondly, there was a recent incident at the judiciary where it's said that a certain super spreader event caused some people there to get infected, and there was some quarantines and so on. Was there any collaboration or communication between the judiciary and the Ministry of Health on that particular event in terms of advice or treatment options and so on? Thanks.
Thank you, Clint. So on the issue of Guyana recording its first case of monkeypox, we have always been vigilant since May 20th, 2022, when I first convened a meeting with PAHO, CARFA, Ministry of Health to prepare for monkeypox. We can't be any more vigilant than we are. As to your question, are we prepared? We have been prepared since May 20th. What did we do from May 20th to now? After we had that initial meeting on May 20th, I took a note to Cabinet to have Her Excellency declare monkeypox a dangerous infectious disease. That would have allowed us to treat with monkeypox under the Public Health Regulations and the Quarantine Act. We did that. We assigned the Cora facility as a treatment and isolation center in case we have our first case of monkeypox. That has been done. It's waiting. Hopefully we don't have to use it. So we are making steps to get the vaccine in. We have been alerting the public since May 20th what the signs and symptoms are of monkeypox. We also alerted the public on May 20th as to which website to use, so you can find the countries that have recorded cases of monkeypox. So if you have visitors, you are interacting with persons from those countries, you need to take particular care. So it's difficult to be any more vigilant than we have been since May 20th. On the issue of the judiciary and the Ministry of Health, any event in any location, the protocol is for the event or the issue to be under the management of the county medical officers of health, not the Ministry of Health. That's why you have all these CMOHs, and they will liaise with whether it's a business place or whatever to advise them what to do to, one, prevent super spreader events, or if there's an event as alleged, what to do. So the Ministry of Health, under the management of the county medical officers, would have, if invited in or if requested, to advise any agency or person, business place as to what to do in case there is a COVID issue to be dealt with. Thank you very much, Clint.
Thank you, Honourable Minister. Next up, we have questions from TV6. Are you ready, Renessa Cutting?
Good morning, Renessa Cutting, TV6 News. Minister Dayal Singh, I know you just said that staffing issues fall under the RHAs, but we did receive a report from a health worker attached to the Cuba hospital, and they're telling us that health staff are being sent home, laid off, or being given 1-month contracts. Is this something that you can confirm or deny, given that you would have said that these people have done very honorable service to the country, especially during this COVID pandemic? And on that note, what is the latest where it concerns discussions regarding tenure for nurses? They have been clamoring for years on this issue. Thank you.
Thank you very much, Renessa. So as I said, the RHAs will make that determination as to their manpower needs depending on their patient load. The second question, with tenure for nurses, that is a matter being dealt with the RHAs. There's also a matter before the Chief Personnel Officer, and I would not like to prejudice those discussions. Thank you very much.
Thank you, Honourable Minister. Next up, we have questions from azpnews.com.
Hi, good morning. Suan Wayo from ACP News. Can you please clarify in terms of testing for monkeypox as to exactly how do people get tested? Is it that from a recent travel history? Are they mandated by the ministry? Is it voluntary? As well as you mentioned that samples, well, you and others have mentioned that samples have went to be tested. How were those samples taken? What process was used to get those samples to send to be tested? That's one. And two, can you also clarify the quarantine period? I know that this was something that was previously discussed, but some people on the ground are saying that some have a certain number of days quarantine, and yet they were still seen to be ill afterwards, and there were some that were in quarantine for a longer period. So can you please clarify on that? Thanks a lot.
Okay, so testing for monkeypox, as we have stated before, is not anybody who has had a travel history. As the Chief Medical Officer has explained on this press conference at a previous time, you take an actual swab from a skin lesion, and then you send that sample for testing to either the TPHL lab or CARFA. So that is how you test. not everyone that comes into the country is tested. Two, the quarantine period. I don't know what you are referring to for this variable quarantine period, but as the CMO has explained, as the pandemic evolved, the quarantine protocols have evolved to go with that. It is now, I believe, 10 days or once you get a negative result. We started off with, I believe, 14 days or 21 days, and you must have 2 negatives. But as the pandemic evolved, we had to evolve with that. Okay? Thank you very much.
Thank you, Minister. We now go to Guardian Media Limited for additional questions.
All right, thank you very much. Minister, earlier this week we had a disturbing report about a baby being left abandoned in the San Fernando General Hospital. Now, I mean, I want your comments on that matter, but also how frequent is it that we see people doing something like this? Is this something that people do, leaving babies at hospitals if they don't want to take care of it or for whatever reason?
Thank you. So, first of all, let me express my gratitude to the staff of San Fernando General Hospital who responded to the cries of that infant and who are taking care of that infant. To my knowledge, this may be one of the first or few occasions that has happened in a hospital setting. I know very often babies are found in other settings, but as far as being found in a hospital setting, this is probably the first one that I know of. Okay, so it doesn't seem to be a common event, thank God. And really, again, congratulations to the staff at San Fernando Hospital for rising to the occasion to take care of this precious life.
Thank you, Minister. Next up, we have questions from TV6. TV6, are you ready?
Yes, Minister, with regards to the unfortunate death of a 7-year-old girl earlier, a few days ago, I wanted to ask, where does the Ministry of Health fall into this? Because it has been reported and confirmed that the mother was treated for some type of mental illness. And I would like to find out what processes are triggered when you have persons in the system with legitimate mental illnesses and they have dependents, children, and things of that nature. What steps should be triggered when a person like this comes into the system? Thank you.
Thank you. So again, this is another very unfortunate incident that happened. The Ministry of Health will treat the person presenting with mental disease either as an outpatient or inpatient, depending on the acuity or severity of the disease. That is a clinical decision to be made by the attending physician if they are referred up the chain of command. For their dependents, there are social services. The Ministry of Health doesn't really have a primary role in making social services available, but they are available from the different child authorities, like the Children's Authority. There's the Ministry of Social Development and Family Services, and so on. And we work together once the issue is raised. Thank you very much.
Thank you, Minister. We have additional questions from Newsday. Newsday, are you ready?
Yes. Yes, hello again. The question I wanted to ask is, when we're talking about the issues of vaccination boosters and so on, what are our current vaccine stocks like in terms of the AstraZeneca, AstraZeneca, Sinopharm, Pfizer, whatever, in terms of what are our current vaccine stocks like, expiration dates, any additional stocks might be coming in, anything that could be said on these issues?
Sure. So Sinopharm vaccines, available balance 247,583, expiring June 2023. Adult Pfizer, as you know, those have been exhausted, and whatever stock that was remaining they were destroyed. Johnson & Johnson vaccines, 186,285. Some are expiring in May 2023 and some are expiring in July 2023. AstraZeneca has been out of the system for a very long time. Those expired sometime last year. So we have no stocks of AstraZeneca holding. The Pfizer pediatric doses, that's the 5 to 11. That was a gift we received from the government and people of Spain. We had received 43,200. The available balance now is 37,778. And as I indicated earlier, those are expiring in October 2022. And that's why we are appealing to parents. If you want to take advantage of the Pfizer pediatric vaccines, especially in light of school reopening, do it sooner rather than later, so we can get your first shot and second shot in before they expire in October 2022. Okay, Clint, I hope that gives you a comprehensive answer.
Thank you, Honourable Minister. Next up, we have questions from AZP News. Additional questions?
Hi, good morning again. Yes, so Minister, I just wanted some further clarification regarding the monkeypox as to exactly who can get tested, where can they get tested, and is it totally voluntary, meaning that, you know, no pressure from any outside institution or anything like that? Thank you.
Thank you. So there's absolutely no pressure put on anybody to be tested for monkeypox. These are persons who come into our facilities either wishing to be tested, who show signs and symptoms, or people coming in with signs and symptoms, and we determine at the clinical level, at the attendant physician level, that this is a case that needs further investigation. And they will take the necessary swabs, as I indicated, and send it for testing.
Thank you, Minister. We have further questions from TV6.
Minister Dayal Singh, with respect to the special payment that is forthcoming for health workers given their service during the pandemic, how do you personally feel, and do you anticipate that there would be other workers from other sectors who, for instance, probably like the protective services, members of the TTPS, who would be able to make a claim on the same basis? Persons who are at this time asking for back pay and increases.
Okay, so Renessa, the Honorable Prime Minister addressed that issue head-on last night, and I will paraphrase his words. It is only for healthcare workers at this time. Those were his, I'm paraphrasing, and that was the exact message. He said it is for healthcare workers because those are the ones who were in the rooms and being most exposed to the virus in those very intimate settings. And I really want to congratulate the Honorable Prime Minister for making that move. Thank you very much, Renessa.
Thank you, Minister. Next up, we have Guardian Media Limited.
All right, thank you. My next question is for Dr. Abdul Richards. Dr. Abdul Richards, now our death rate seems to be going back up as well in line with the increase in COVID-19 cases. I believe just 12 days ago, we had a 7-day rolling average of 0. Now we're up to 4. I'm just wondering if you would be able to give us a breakdown of who is it that we're really seeing dying at this point in time? I mean, I know we have the breakdown with vaccinated versus unvaccinated, but what I also want to know is what sort of comorbidities are we seeing at play? Is it those who have uncontrolled hypertension, diabetes, whatever, those who are very sickly to begin with, is what I'm really asking? Or is it that we're seeing even relatively healthy people as well that are dying?
Thank you very much, Richard, for asking that very important question. Yes, there has been an increase in the number of deaths, and this is expected because we've had an increase in the number of confirmed cases and an increase in hospitalizations. However, when we speak to the clinicians at the hospital and Dr. Trotman, the pattern continues to be the same, where there is a significant proportion of persons who are not fully vaccinated or unvaccinated. So that's the first point. And secondly, These are persons with comorbidities. These are persons who may have had incidental COVID. That is, they would have presented to the hospital with another medical condition. For example, they may have been a terminal cancer case. They may have uncontrolled diabetes, hypertension, be in chronic renal failure, and also not be vaccinated. And then, unfortunately, they would have demised. This information and this clinical picture really emphasizes the need for all persons who are high risk and who have comorbidities to please become fully vaccinated. Vaccination protects and prevents persons from being hospitalized for severe cases of COVID-19. Thank you.
Thank you. Odessa, just permit me here to amplify on what Dr. Richards has said. And Richard, you asked the most important question because it gives us the opportunity to explain how we track this. So on the 3rd of August, the rolling 7-day average was 174. The rolling 7-day average for deaths was 1. So you are spot on. On the 10th of August, 7 days later, the rolling 7-day average went up to 265. The rolling 7-day average for deaths was 2. On the 17th of August, the rolling 7-day average for cases was 280, went up slightly. Rolling 7-day average for deaths was 1. Today, the 24th of August, whilst the rolling 7-day average is now 273, so the rolling 7-day average, 265, 280, 273, seems to have plateaued. But the rolling 7-day average for deaths is 4. What you find, and if you go back and look at the picture and the pattern, and this is something that we discuss all the time, you normally get this 2-week lag between cases and deaths. So that's why on the 3rd of August, rolling 7-day average 174, deaths 1. 2 weeks later, and it's started to climb, you will kind of get this pattern of deaths going up about 2 weeks after cases start to rise. And Richard, the question you asked this morning, that question is the main point that needs to be made at this press conference this morning and for the country. We cannot become complacent. Too many people are becoming complacent, exposing themselves in a lots of social settings. When I look at the events and so on, without masks, even if you are young and you are unvaccinated or vaccinated, unmasked, but then you go home and expose your COVID status to your elderly parents, grandparents, that is the kind of transmission that we would advise people to be aware of. That even though you are well and you expose yourself to the virus by being in a big setting unmasked, you run the risk of really affecting negatively your elderly parents or grandparents. At this stage of the pandemic, where things seem to be winding down, I am choosing my words carefully, seem to be winding down, we don't know what is around the corner. We still urge people to practice the tried and proven. Wash your hands, wear your mask. You see this mask right now? Between masking and vaccinations, those are the two most important things we can do to get this rolling 7-day average of deaths from 4 to go down. Okay, Richard? Richard, really, really congratulations on that question.
Thank you, Honourable Minister. And as we move on with this round of questions, we invite AZP News.
Hi, just one final question on the monkeypox. So is it safe to say that anyone can just go into like a health center then, more or less get tested and the information would be sent to the Ministry of Health?
Okay, so Suan, as I have explained a couple times this morning, testing for monkeypox is not a nationwide thing. You just walk into a center. Testing for monkeypox is based on symptomatic presentations, especially if you have a skin lesion, a fever, and the other typical signs of symptoms of monkeypox, swollen lymph nodes, and so on. a normal person presenting like myself with no skin lesions, there's no sample to take. So the clinician will make a determination based on the clinical presentation of the patient in front of them, whether a degree of suspicion arises, and the appropriate sample will be taken from a skin lesion to be sent for testing. Okay, I hope that really clarifies the issue.
Thank you, Minister, for that clarification. We now move to TV6 for additional questions.
Okay, so final question, Minister Dayal Singh, you would have stated that 12 samples were sent for testing for monkeypox and they were all negative. Could you share with us possibly what was the clinical presentation of those patients and what they were diagnosed with that they would have had the need to test them for monkeypox, please? Thank you.
So, Renessa, I as Minister wouldn't have the individual patient files in front of me. I have tried to go into some detail about the procedure and protocols for monkeypox testing. And also because it's a small number of people, patient confidentiality prevents me from talking about individual cases because it's a small number. I don't want people to believe that the Minister of Health will come on TV, even though I don't call their names. We need to be very careful not to drive this underground. So, to reiterate, a person presenting to a physician, both public and private sector, it is up to the physician, based on their clinical signs and symptoms, based on the case definition we have sent out to both the public and private sector way back in May, to make that determination at their level about whether a degree of suspicion arises, and they will do the necessary testing. Okay? Thank you.
Thank you, Honourable Minister. And if there are no more questions, with that, we have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are available for everyone 5 years of age and above. If you have not received your COVID-19 vaccine as yet, please get yours now. Remember, the vaccines are safe, effective, free, and available at multiple locations. We invite you to visit our website at health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we continue to roll back restrictions, let's continue to observe the 3 W's. Goodbye for now and have a pleasant day.